Good afternoon, everyone. Thank you for joining us here today. My name is Mark Natali. I'm the Executive Director of the American Heart Association in Western New York. And we are absolutely thrilled to have you join us for our first community conversation series on matters related to what matters most in our community. And that right now is COVID-19, the pandemic, and all of the things that has happened in the past 3 months throughout our community, from a health and a business and just an overall Western New York impact. I want to give a special thank you to M&T Bank, our sponsor for this panel, for helping us really put this together in a timely and important way. So thank you, M&T Bank. Now, the American Heart Association is working with researchers, medical experts, community leaders, businesses, families, schools, and more to reduce the impact of the coronavirus and the pandemic across Western New York. Our priority is top of mind is the health and well-being of all individuals and their families, locally and across the globe. So we want to keep you informed with trusted science-based information and provide our communities with support and resources available from the American Heart Association. So over the past 3 months, the AHA has discovered that COVID-19 has had much more of a cardiovascular effect than we thought previously, with underlying conditions like hypertension, diabetes, and obesity, as well as those that have had cardiovascular events in the past. And those have put those people at more risk for complications related to COVID-19, but also this whole downstream effect that we're going to be talking about today that has had serious implications and future implications for the Western New York community has made our mission more critical than ever. So the past few months, we have really responded and pivoted the things that we do in Western New York. We've fast-tracked ventilator training for all our hospital systems. We have put in place $2.5 million in short-term quick research funding directly for pandemic reasons. We've trained hospitals and communities in CPR, accelerated the discovery of antiviral drugs, and gave communities, companies, and schools the virtual things that they need to keep themselves healthy at this time. So today, we are really excited to be joined by 3 local experts for our panel who have graciously dedicated their time to help us explore all of these things around COVID-19 and the community and their impact on cardiovascular health, racial and ethnic disparities, as well as the local community. So I'm really pleased to welcome Marie Cannon, Commissioner of Erie County Department of Social Services and co-chair of Live Well Erie, Dr. Vijay Iyer, who's a cardiologist and director of the Gates Vascular Institute and board president for the American Heart Association, and Reverend Kinzer Pointer, who is pastor for the Liberty Missionary Baptist Church and co-convener of the African American Health Equity Task Force. Thank you, the 3 of you, for joining us here today.
Thank you.
Thank you.
Thank you. So those of you in the audience, please utilize the chat box to ask any questions anytime during this presentation. We have some staff of the American Heart Association who will be monitoring the chat box, and we will be reserving time towards the end of the panel discussion to answer all of those questions. Now, before we get started, I would like to invite Pastor Kinzer Pointer to lead us in a 2-minute mental health exercise. Pastor?
Thank you, Mark. Welcome to everyone in the community, and thank you for joining us today. This is an important conversation. It's 3 months and a week since we went to New York Pause and seen our entire lives disrupted. Even before we went to New York Pause, our lives were already being disrupted. In this moment of collective disruption, many of us may be suffering through some kind of trauma, both physical and mental. 124,000 of our fellow community members have been identified as dying from COVID-19 in the United States. This is a moment for us not only to recognize our collective pain, but also to share in the reality that we can begin a collective healing. So I'd like for you to lend yourselves to me for just a few seconds. I will ask each of you, if you will, to close your eyes and to visualize while you're closing your eyes some of the most exciting times in your own life. Some things that were so joyfully memorable that when you close your eyes, you can actually see them. And then together, let's take 3 deep breaths. Breathe all the way in and then exhale all the way out. Again, and out. Again, and out. I want to remind you that we're together, that we can get through this together, and that just as you visualize joyful times, those will return. But today, let's commit ourselves to work together to reduce the impact of this vile disease on our entire community, but especially on those who are dealing with cardio and cerebral vascular disease. Thank you for lending yourselves to me.
Thank you very much, Pastor. That definitely focuses us and gets us in the right mindset for the discussion we're having here today. So, first up, I'd like to start, Marie, with you. Thank you so much for your work across Erie County and from the government perspective. We entered phase 3 for Erie County, and we're seeing businesses and different things opening in varieties of capacities. So, can you please provide us with an overview of what you've been seeing from that Erie County government standpoint, especially a comparison of where were 3 months ago and kind of where we're at and where we're heading?
Okay. Can you hear me now? I feel like the Verizon commercial all the time.
You sound fantastic. Thank you, Maria.
So I want to give a the human services perspective. And one of the things that when this started March 16th for us, one of the immediate crises that came to light was housing. We were starting to see almost 300 people per day that was in need of housing and shelter. Now, normally we wouldn't see these folks come through the door, but a couple things were happening. Other emergency shelters were closing, or they reduced their capacity, or they stopped taking referrals. And honestly, the bus stations were closed, the libraries were closed, people weren't on the street as much, so there was panhandling wasn't available. Restaurants were not open, and what that meant for people who were experiencing homelessness is that they did not have opportunity to provide meals. I know that sounds kind of bad, but that was one of the survivals. And so from that day, we've seen 300. We still continue to see that number, but we are seeing people now being able to go into more stable housing. The other issue that we saw specifically, it was a dramatic increase in the number of SNAP applications, and that's for food stamps. So it was high as we got 500 applications per day, 13,000 applications up until the date. And so we just recently began to see the decrease. So more than 500 applications, now we're down to about 50 or 60. So we're seeing some of the immediate need begin to recede, and now we're just pivoting to the next portion of what the long-term need will be. But I just wanted to share at least those 2 points as what we started with and what we're beginning to see change and pivot.
Wow, that's amazing. I know, and I have a background. I know we spoke about this. I used to be in human services, just like you. I was a deputy commissioner in one county. I was the head of finance and administration for another. So I understand the legwork that your department does, particularly, and how housing, food, transportation, all of those things really do come together. And we talk about the social determinants of health a lot. at the American Heart Association, and certainly will be a theme throughout this conversation with our panelists. So what are we looking at? Because when we talk about those insecurities through a very concentrated period of time, what do you think the downstream effects are going to be for the overall community, Marie?
I believe so. Live Well Erie started this. Live Well Erie actually became very clear for Live Well Erie of some of the disparities in the social determinants of health, and especially around housing. So we just see it as at that point, it was the immediate need of crisis. We need to provide shelter for people today, and we need to provide food. But the long term and the cascading piece of this is, what will we do in the long term to provide affordable housing for anybody who needs it? Healthy, stable, affordable housing. So we know that is the next kind of mountain that we'll have to get over, is affordable housing. Then the issue of, and later on I'll talk a little bit about the economy and the loss of jobs in this area. Right now we're experiencing unemployment rate of about 18%, 123,000 county residents have applied. The long-term effect for that is going to be huge. So if people don't have jobs and they don't have a way to feed their families, I think the need for social services will go up, but the impact for the greater community will also be that these were people who typically might have been giving to nonprofit agencies who supported folks. Now they're going to be people who are now going to have to receive services from some of these nonprofit agencies.
Wow. So you mentioned Live Well Erie, and I know there's a couple other committees and community collaborations out there that are really, started before COVID-19 and had a certain direction, and now had to take, which fortunately we are very rich in collaboration in Western New York, and people like yourself and even Dr. Iyer and Pastor Pointer are on these collaborations. So how has that really pivoted that work, and what are the solutions that these collaborations like Live Well Erie, since you're the co-chair, how are we going to tackle this, and how can we involve the greater community maybe?
Right. So one of the things that, as I think I said earlier, this pandemic really highlighted the disparities in our community. And for us, in terms of Live Well Erie, it became so clear that we really did a hard pivot to say racial equity. Looking at our work through a racial equity lens was always one of the guiding principles. But now we're saying we don't have the luxury of kind of walking through this. We need to take some immediate steps. So the first thing we did, especially and you're right, this is a very collaborative community. We're actually hosting a housing task force to really look at first, one of the immediate needs that will come into play is going to be, as the moratorium on evictions are lifted. Some of that have already started as of June 16th, but also August 20th is when the moratorium on evictions for non-payment of rent and mortgages will be lifted. So we're in this phase now with this housing task force that we have to look at that first. And then our secondary goal is to say, again, what are we going to do around ensuring that all members of the community can have health, safe, and affordable housing? So right now it is doing the work of what are some strategies that we're going to be able to get into place very quickly to assist folks that are unemployed, have been impacted by the COVID-19, and especially some communities of color who are going to be even harder hit around this because of some of the fragility that they were already in. So we're looking at immediate and then what will be the long term. And we did that with all areas of our Live Well committee, also including childcare, because that's another issue, and including supports for working families.
You just mentioned childcare, and I think there's, a lot of people in the audience, here today that it's been an interesting time with childcare. And, I think I'm a fantastic 8th grade teacher, by the way. But I usually teach college, but 8th grade and actually 5th grade has been a side job of mine, and I know a lot of other people. But childcare has really seen an interesting effect, and especially for those who are, working families, but single moms. But, what are we seeing with childcare, and what can we expect from it, especially for those that maybe have been furloughed, lost their jobs, or need to seek employment? I mean, from the DSS perspective.
Yes. So we actually started a child care emergency task force. We've always been working on this issue, and a couple of things happened. One, currently, 43% of child care providers are closed in Erie County. So that was okay at the beginning of this pandemic because so many people were at home. But as the economy is beginning to reopen and people are coming back on site to work, then the capacity of child care could be strained. We know that initially there was CARES funding for essential workers to help pay for it. Our own DSS subsidy expanded our eligibility for just somebody making up to 85% of the state median income. We were able to waive all co-pays for any parent. We expedited the applications, but currently there are only a few summer programs that are opening because of some of the health requirements. So as the economy begins to open back up and people come back to work, the strain on the capacity of childcare is definitely one of the concerns. And the other concern, frankly, that I have is for those programs who now have to operate at almost a 50% capacity level, will they have the financial infrastructure to remain open? And then those who were temporarily closed, do they have the financial support to open back up? So again, this is where another business segment is being impacted.
Right, thank you. And it's, it is such a complex issue, just childcare in and of itself, because, again, there's a catch-22 with businesses and opening, and, parents who need to work but have their kids, right? So there's a lot surrounding that topic, which could probably be a whole nother hour or two in and of itself. But, I want to thank you, Marie, for now. We'll kind of come back to you in a little bit. I want to remind the audience, any questions for Marie, please feel free to put in the chat box, and we'll get to that part later in the program. But Dr. Iyer, I want to kind of come over to you. We obviously, American Heart Association, have been really on the forefront of recognizing and putting money in research, but also we started a national COVID registry utilizing existing technology platform within every hospital across the United States, identifying all those unique markers to patients that have presented themselves with COVID. And it's been actually really, really interesting to see who has been affected more or less. I'd just like to hear your perspective on what it's looked like from the seat of a physician, and particularly a cardiologist.
Thank you, Mark. Thank you for the invitation, and thank you to all the other panelists. So it's been a very interesting 12 weeks, interesting in some in good ways and some in bad ways. When the COVID pandemic sort of was over in Europe, we were watching with some interest and trying to learn from it. And then when it hit home, it was a bit of an eye-opener for all of us in terms of our capabilities, in terms of what we were ready for, what we had planned for, and what we had not planned for. So I think it opened our eyes to a number of different things, but it also opened our eyes to many different aspects of healthcare that we will be dealing with now and for the foreseeable future. So let's talk about COVID itself. We heard from many people that the vulnerable population were the elderly, the immunocompromised, the people with pre-existing conditions. No question about it. And I think, for us with New York Pause, we were able to contain it, at least in Western New York. We didn't see its impact like we saw it in New York City, but it did have a huge impact on healthcare. We stopped doing elective surgeries. We were bracing ourselves for an onslaught of patients in the ICUs. We were starting to think about how are we going to rationalize our ventilator use. Fortunately, it never came to that, but something that we had to learn from. We started to think about what happens if we have patients who need advanced support, things like ECMO, if their heart and lungs are failing, who is a candidate, who's not a candidate, how do we rationalize that care, because that's even more expensive. The second part of it, which became very apparent, is that the fear in people's minds when COVID came about, the closing of healthcare offices definitely had an impact on them, because even now we are finding people are reluctant to come back to the hospitals, reluctant to go to their doctor's offices, and that is impacting their cardiovascular health. Right? You know, my biggest fear in the last couple of weeks has been the fear of seeing people who have let their disease process go so far that when they come to us, it becomes extremely difficult for us to take care of them. So that was the other aspect of it. Many people had to put off elective procedures and elective surgeries because hospitals were closed. Many people put out doctors' offices. They did video visits. Video visits were great because it opened up a whole new avenue of telemedicine, which is fantastic. However, it also brought to fore the, the concept of health disparities. The people who had cell phones and iPads and computers were able to avail of these facilities. But what about those people who did, who actually depended on that physical visit to the ER or to the hospital to get their care? How now, going forward, as telemedicine becomes a part and parcel of our lives, do we make certain that those people who don't have access to advanced technology or Wi-Fi and internet, how are we going to provide care to them while they continue to be fearful of coming into the hospitals? You know, and what does this mean for us as a healthcare system? How do we make sure that care is still equal and equitable for everybody? So those are some of the short-term consequences. Now, as Marie pointed out, as we go long-term, our new worry is going to be the financial hardship that people are going to go through. People are going to lose jobs or have lost jobs. They may not have the resources to really take care of their basic needs. How does that impact their ability to take care of their health? Will the loss of healthcare, either by loss of insurance, have a huge impact on the ability of these individuals to continue to care for themselves and their families? That's going to be an issue that we need to deal with and look at as we go across. And the third part, hospitals have had a huge financial setback during this time. They've all taken huge hits, and that means that over the next year, despite the bailout, the federal and the state bailouts, they may all be in significant financial hardships, which inevitably leads to cutting off care. It inevitably leads to reallocation of resources, and that will mean that the ability to provide care to some of the most needy people may be compromised. So we have to look at all of this as we go forward and think about how do we retool as a healthcare system and as physicians and as officers to make certain that we are able to provide all of the elements of care that we were providing before COVID.
And that's, again, just like we were saying with Marie, such a complex situation. It's not one thing, it's multiple things, and they're all downstream. So, even Marie mentioned the health disparities, but she also mentioned about food insecurity. And we know from a, cardiovascular health side that nutrition, physical activity, all of those things really lead into better health. Or poorer health if you're not in that benefit situation. Housing, all of those things really do play into your overall health. But Vijay, so all of those things that you mentioned, all the challenges, what are we doing from just an overall, not just Kalia, but an overall health systems to really put all of those challenges right in the forefront, so that we know that anybody who walks in the door, first of all, walk in the door. If you're feeling, something that's not right, if you're feeling chest pain or anything, please call 911 and get into the door. And I just want to hear from you a little about that, and because I think it's fear of just calling 911, walking in, and why those reasons. But also, do we really have the capacity to treat everybody right now?
So there are two aspects. One is every physician's office and every hospital system has put into play some significant measures to make certain that both the patients as well as the providers are safe. So I think that's important for people to recognize that safety is first, and we are doing everything to make sure that nobody in the community or nobody who's in a hospital taking care of patients is exposed in a way that is going to put them at risk. I think that's extremely important. Second, we have the capacity. All the offices are back up and running, either by video visits, telephone visits, or in-person visits. We're all doing in-person visits. So if you're an individual who has had a history of cardiovascular problems and has been seeking care, this is not the time to step back and say, I'm fearful, because two things. One, your cardiovascular problem puts you at higher risk of complications from COVID. Second, if you do end up with coronavirus infection and you have not taken care of your cardiovascular health, you are more susceptible to a worse outcome. So I think it's extremely important for people to recognize that they do not want to neglect their healthcare at this time. In terms of hospitals, if you have a problem that you would have in normal circumstances, called your doctor or gone into the doctor for, or come into the emergency room, nothing should change. We have all put in place multiple steps to make sure that people are safe in hospitals. The hospital today is the safest place possibly to protect you from coronavirus. So I'll give you an example. In our system, Kaleida Health, we tested all of our individuals with antibodies to coronavirus, and only 4% people of healthcare professionals were positive as compared to about 8% in the community. That means despite the fact that healthcare professionals were exposed and taking care of people who had coronavirus, because of the PPE, because of the measures in place in the hospitals, the rate of infections were very, very low. Second, those healthcare professionals who did contract COVID often ended up getting it from exposure in the community, not from exposure to patients. I think these are things that people need to list here and understand that they are safe in the healthcare setting, the healthcare environment is safe, and they should not neglect their care.
Thank you for really clarifying that. And that is amazing, the testing and the outcomes that you've seen, because I think just as a general community, people who aren't familiar with what goes on behind the scenes think that, well, you know, if I go to a doctor's office, I go to hospital, that's where the germs are, right? And what you're showing is that all the steps and the extra steps that everyone's taking, really it is a safer place. So maybe we can pivot a little bit off of that to talk about social distancing, masks, you know, like, what does that mean for the community, and why were those put in place, I guess, in the first place? What does social distancing do, and you know, masks in particular? Because I think there's a lot of confusion around why wear masks, don't wear masks, you know, dose time. Can you talk a little about that?
So the concept of social distancing is very simple. Close proximity of people in contact with symptomatic or asymptomatic carriers of the coronavirus is what has been shown to increase the incidence of transmission. So the concept is that since we don't test everybody and we don't know who has or who doesn't have the disease, the concept of keeping a social distance in terms of contact will minimize transmission. We also know that it is mostly a problem of airborne of transmission. So the masking helps. How does masking help? Masking helps in making sure that an asymptomatic carrier of the disease is not transmitting it to anybody else. Masking helps in protecting the person who's wearing the mask from making sure that they don't inhale particles and become infected themselves. So to me, masking is about as important, and there's a ton of literature now that has come out from Asia, from Europe, showing that masking definitely decreases the transmission rates for coronavirus. So to me, it is a no-brainer. It is a low-risk intervention. It is not expensive. You don't need a fancy N95 mask. Even a cloth mask has been shown to decrease the incidence. But I think as an individual in a community who has a social responsibility, not just for their own health, but for the health of the community, it is the least you can do to protect yourself and the community, is to mask when you're in proximity to other individuals.
Great, thank you. And I think that there has been such conflicting information about masks, but I think every expert, no matter who you ask, says masking works, distancing works. And I think you brought up a good point about it doesn't have to be an N95 mask, right? It could be any type of covering because it is about the particles, and that's what keeps it out two ways, right? So thank you.
That combined with frequent hand washing, I think these two are low risk interventions that really go a long way in preventing transmission. This is not new information. We've known this for years. We knew this when we had the flu epidemics. We knew when we had the SARS, the original SARS epidemic. We knew when we had the MERS epidemic. You know, it's not like we're reinventing the wheel. We've known this. It's just that the magnitude of the problem is such, and the political messaging has been so conflicting that it has become a bit of an issue.
Right. Right. So wash your hands with soap, sing happy birthday twice, and wear your mask.
As many times as you can.
Three times is a charm. Yeah. Okay. Thank you, Dr. Iyer. I want to go over to Pastor Pointer. Thank you so much for being here again. You're extremely involved in this community. I mean, not just in the church capacity and health ministries, but particularly your role as a co-convener with the African American Health Equity Task Force. I think is something we want to talk a little bit about, because as we heard from Dr. Iyer and also Marie, health disparities during this time has been, I mean, they existed before, we know this, but it has had such a spotlight shown on it that it has been a ton of conversation anywhere that you look, health and racial inequalities, but particularly when it comes to health is really on the forefront of particularly the American Heart Association perspective. So can you talk a little about why this has emerged and what you're seeing from your seat?
Well, we knew early on that we were going to experience real problems around the social determinants of health with respect to health disparities, because we know that there have been for decades bad policy and decision making that has rendered certain socioeconomic conditions to have worse health outcomes. We know that if you present in our healthcare system, which is even now in the midst of a pandemic, the best healthcare system in the world. There's no question that we have the best healthcare system in the world in the United States. But if you presented in this healthcare system and you were from the lower socioeconomic rungs of our society, you were going to present with other conditions that would make you more susceptible to negative outcomes with coronavirus. Why is that important? It's important because it means that we could do better. We could make better decisions with regard to policy, that we could bring equity to people who are in the lower socioeconomic rungs by providing good health care in every neighborhood, without regard to whether someone could pay or not, without regard to race or ethnicity. Just give everybody good health care. Dr. Iyer talks about the absolute impact on persons with cardiovascular disease. And that's heightened when someone's cardiovascular disease is undiagnosed, untreated, or when the person doesn't trust the system enough to listen to what their primary care physician has told them they need to do to manage their cardiovascular disease. What we've learned as this disease has held on to us, and we'll learn even more, but in the last 5 to 6 months, we have learned that if people had cardiovascular disease and they were taking their medications, particularly the ACE inhibitors, they had a quasi-protective factor that kept them from having as bad an outcome with COVID-19 as if they were untreated and undiagnosed. So we know that if we just simply erase all of the foolishness around providing health care, and let's just make sure that every American has health care, and that when people come into our country, let's not throw up such walls that we ourselves can't see, and that we can't see someone's humanity. So that when people come into our country, whether they are through the broken immigration system, either by getting a visa, by getting an entry visa and a work visa, or because people transverse the borders at all the boundaries, or because they get into the country and overstay a visa. Let's not get bogged down in that kind of foolishness. Let's just make sure everybody has health insurance. We can deal with the other things more effectively when everyone is healthy. We also know that when people are poor, that it's not always that they are ignoring their primary care physician or being the quote difficult patient unquote, but sometimes it's simply because people are choosing between the immediate need, which is food, and the long-term need, which is to follow the doctor's advice. And we ought to, in the country that wastes more food than the rest of the world together, we ought to be able to easily eliminate that. And so those are the kinds of challenges that we see and that impact people primarily because of the social determinants of health.
Thank you, and and again, I think it's really interesting how all of our panelists are kind of seeing the overlaps of the work that each of you are doing, respectively, professionally, but also in the community, from a social determinants of health perspective, from a community perspective. I want to kind of talk about mental health a little bit as well, because I think all three of you have seen the effects of as Pastor, you just mentioned, when you're lower income and you have to choose between things, I mean, that really does put a strain and a pressure. Maria is trying to help with the food insecurity, the housing, all of that, and that is a huge, huge mental impact. And Dr. Iyer certainly sees, those conditions from a patient perspective. But Pastor, I know you and I have spoken previously, and you're passionate about really putting a bigger spotlight on mental health at this time. So can you talk a little bit about why that's really important and the work that's being done around it that you're involved with?
Well, I'm sure that Dr. Iyer will agree that only in the United States of America have we stigmatized the part of our health care that deals with our head. How are we doing? How do we feel today? What are the challenges that we face? We're the only country that doesn't make mental health care a regular part of medical care. And yet, mental health care is a regular part of health. The fact of the matter is that we've stigmatized this, so we've kept people from getting or seeking mental health care because we use all kinds of virulent euphemisms. Oh, she's just crazy. He's out of his mind. Those kinds of things don't encourage people to get the treatment that they desperately need. And when we approach people holistically, the whole person, they can't simply be physically healthy. They have to be healthy emotionally, mentally, and psychologically. When people are not healthy in those ways, it's very difficult to see to the other physical health. What we are doing is in the project that we're operating as the African American Health Disparities Task Force, we're asking the people in this community the PQH9 questionnaire. The reason we're asking the questionnaire is because people don't really have conversations with other people about how they're doing psychosocial. They just don't. And because they don't, we're already calling people on the phone, having conversations about their social well-being. It just made sense to extend that to the psychosocial and to ask the questions on the PHQ-9, and then to work with a partner so that when people score in the concern, that they get automatically referred for someone to call them and have a conversation with them around their mental well-being. The reason we are doing that is because it just makes good sense. And that in this pandemic, while all of us were in the house, there are some conditions, we name them. We say you're stir crazy, you have cabin fever, all of those things that come with not being out and exercising usual social interaction with each other, that brings out a whole nother level of mental care that needs to be exercised. And most of us, because we don't talk about our mental care in all the other aspects, we don't really know that we're suffering. And then we're watching people die around us, people we know and people we don't know. And I said earlier that as of this morning, more than 124,000 of us have been identified as dying from COVID. This is a massive trauma on us collectively. And so when you have trauma, you need somebody to talk to. And it doesn't have to be a mental health professional, just having another human being to have a reasonably friendly conversation, to have someone inquire about how you're doing. Do you need anything? Can we help you? Those things matter. And that's why it becomes crystal clear that this is something we needed to do. And so we are doing it. And the result has been, we've been able to refer people for care who had red flags because they answered the questions on the PHQ-9. But on the other side, we worked with our partner Endeavor Health Services to make sure that we've also referred people who, just after having a conversation, seemed to us that they could benefit from a second conversation. So we're referring them directly.
Great. And, Marie, I want to kind of ask you a similar question. When people present with maybe a housing crisis or a food crisis, or, just presenting for SNAP, I'm sure from the Erie County government perspective, it's not just solving that one issue, but we know that there's so many others that are involved. So when somebody walks in the door, how are we looking at those things like the pastor said, are we screening for mental health at the same time we're looking at income for eligibility for, TANF or food stamps?
That's a great question, Mark. So in our homeless services, we actually have a licensed social worker, and we actually are screening for mental health, because at some point what we realized was that a number of the folks that were presenting for homelessness actually had mental health concerns. And so we've been able to, I want to say mid-area, I know they have a new name and I can't remember their new name.
Endeavor Health Services.
Thank you. So we have an on-site licensed social worker who will do the initial screening, like as Pastor Pointer has talked about, and then referrals to a more in-depth if there's a need for that. And then also in our services, because you're absolutely right, people might show up, they need food stamps or they need housing, but there are a ton of other issues. And especially in our services department, and I mean child protection or adult protection department, we also have on-site a co-located mental health counselor and a domestic violence, because that's the other area that we have seen some growth in. So although our calls for CPS are down, but 30% of those calls are now also have domestic violence. In our APS adult protection services, when we're getting referrals, 17% have domestic violence issues. And before the pandemic, those numbers were not there. And the other thing that's happening in terms of, and I agree with Pastor Pointer in terms of the stress that are on families, that most people have been, housebound. But if you have the additional stress of you're worried about your finances, you're worried about feeding your kids, you're worried about homeschooling your child, and then you just have all of these issues, and you have the trauma of what's happening in the community, then we know that places additional stress on families. So some of the things that we're doing in our services, so those families that we have some concerns or are at really high risk, we're doing additional visits to them, and we've been out in the field this whole time using some personal protection and some safety guidelines. But we're engaging with our families probably more now, believe it or not, than when we did pre-pandemic, because our caseloads are down. So now we can have more touches to those families.
Mm-hmm. That's what I was going to ask is the capacity, given that caseloads in most counties have been overburdened. So it's great to hear that you're able to really serve the community in that way, and very encouraged that there's so many ways that mental health is being incorporated into any walk-in service. And Dr. Iyer, I'd turn that over to you as well. When people present themselves with a medical emergency or anything, how is mental health playing a part, especially with any underlying trauma, and how that really presents medically?
I think both Pastor Pointer and Marie pointed out some key issues. We have never been a perfect society, nor have we ever been a perfect healthcare system. I think this stress just amplified all the problems that we had in our system. I think it just showed us all the weaknesses that have been inherent to this system, and just brought them up to the point where we look at it now and say, this is really an issue. The domestic violence issue, the fact that people did not have an outlet and they were not going out of the houses, the stress that fear creates, the stress that the inability to interact with other people, the fear and the stress in people who are unable to take care of their elderly parents because of social isolation, the lack of travel. All of that adds to people's stress levels. It adds to exacerbation of their underlying medical and mental health issues. And I think the mental health issues are, as the pastor pointed out, have been underlooked for many, many years. We recognize now that when we talk about the multiple determinants of well-being, not just health, but of well-being, health, the physical aspects of health, the emotional aspects of health, and the mental aspects of health, are all what come together for a person to have a good quality of life. And I think for too long, we have really focused as a healthcare system more on the physical aspects and underlooked the emotional well-being and the mental health well-being. I think when I, as a cardiologist, see somebody with high blood pressure, it is no longer enough for me to just talk about medications, salt, things like that. You have to look into the other aspects. What are the stressors in your life? What is it from your lifestyle standpoint that's impacting the control of blood pressure? So those social determinants and a crisis like this really highlights all the deficiencies in our healthcare system. And I think if we learn nothing else from this crisis, we have to recognize that we have to start paying attention to sort of the wholesome view of people's well-being and take care of it.
Thank you. Thank you. So, we have about 7 or 8 minutes left. I do want to ask Michelle of the AHA staff if there are any questions that have been posed through the chat box. And remember, attendees, please ask questions. We have 3 fantastic resources here who are experts in their field and in the community. And we'd love to have any questions at this point. So, Michelle, do we have any questions on the wait list?
Yeah, so this question is actually for Dr. Iyer. What are some of the signs and symptoms that people need to look out for, especially those who do have cardiovascular disease, to pay attention to, especially during this time of COVID?
So one of the common things, is everything that your physician told you to watch out for. Things, if you have an existing cardiovascular condition, your blood pressure, your weight, if you see swelling in your feet, trouble breathing, the one I get a lot is, hey, how do I distinguish between trouble breathing? Do I have COVID? Is that why I'm trouble breathing? I think it's important for people to say, hey, I have some symptoms that are different from what I normally feel. This is not a time to sit at home and use Google as your source. This is a good time to call your physician and figure out if this is something that you need to be seen for, or is this something that can be managed over a phone or a video visit? So I think from a COVID standpoint, I think everybody knows all the symptoms in terms of trouble breathing, cough, fever, chills, all of those things that should cause you to seek attention. And remember, not every symptom needs you to come to the emergency room or to the hospital. You have resources that you can call. Phone visits and telephone visits are a good way to triage and figure out if somebody needs to come into the hospital, the office, and that would be the way to start.
Certainly chest pain. If you're feeling chest pain, call, go to the emergency room, right? Because we talked about that before, is the fear of possibly catching COVID or the fear of overburdening the system. But as we pointed out, in particular, Dr. Iyer, it's the safest place and you're ready for it, and don't delay, right?
I think it's extremely important to point something out. In the last 12 weeks across this country and across the world, there has been a dramatic reduction in people showing up with heart attacks, with strokes, with aortic dissections, with heart failure admissions. So I can't believe that COVID cured all of that. So the assumption is that people are staying home and are not showing up. And that is corroborated by data that shows the incidence of cardiovascular related mortality in New Jersey went up by almost 200%. The incidence of in-home cardiac arrest went up by almost 800% in New York City. So people were just avoiding care because of fear of COVID. And I think really the message needs to go out that the healthcare system is open and running and it is safe.
Perfect. Thank you. Michelle, next question.
Sorry, I forgot I was on mute. So this question is actually for Pastor Pointer. So food insecurity and access has been an issue in our community for a long time, but now due to COVID-19, we are seeing inadequate access to healthy food becoming increasingly more difficult for those in certain populations. So I wanted to know a little bit about your role in this and what you were doing, especially with your church project that you have going on to address this issue.
Well, in the COVID-19 Community Response Project, we have call centers set up in 15 churches in Lackawanna, Buffalo, North Tonawanda, and in Niagara Falls. And we're calling and asking, how are you doing? Are you experiencing food insecurity? Have you experienced it in the last week, in the last month? And if we get a yes, we simply offer, we'll bring you food. If you will allow us to, we'll deliver food to you. So we get the right, make sure we have the right address, make sure we have the best contact phone number, and then find out who are the number of people in that family and what are the health restrictions. You know, what don't you eat? What are you allergic to? And then we deliver about a week's fresh fruits and vegetables and dry goods to those families, so that food insecurity is dealt with immediately. We're set up to do this well into August. I would invite anybody to reach out, because food insecurity was real prior to COVID. It's even more so now. Marie told us earlier that our unemployment rate in Erie County is over 18%. We're going to see more food insecurity. So this work becomes critical, and we are pleased to do it.
Thank you. And maybe one more question. Do we have a question for Marie?
We do. So Marie, as we look to enter phase 4 and a lot of businesses are starting to go back to work, starting to reopen and setting their plans, you know, there is this fear of how do we respond to this health crisis as a business owner, and how do we take care of the health of our employees? What are you seeing, and what are some things that business owners and businesses need to know during this time?
Sure. I think one of the first things that we're seeing is a sense of uncertainty, because the rapidly changing environment which businesses are operating are causing cascading uncertainty. So the other issue I think that businesses are facing is their workforce. So one of the major concerns for the businesses that we've been working with through the countywide business task force is that they're concerned of their staff not returning to work, or the fear of returning to work. So there are, on our website, erie.gov//COVID-19, there's a ton of resources around some of the guidelines to do that. They also are concerned about furlough workers not returning because of the additional increased benefits for unemployment. They are beginning to struggle with that. And then the last, as I said, was the child care issue that currently 43% of child care programs are closed, but we have a ton of resources on our website for that. So we have Child Care Resource Network, which will connect workers to employment and to child care providers, and then resources are around for the businesses around their concern for their workforce. The other thing I think that we're also hearing and seeing is the need for financing, because they've been closed, and and this is probably one of the toughest recessions that we've seen, and we don't know the long-term impact of it. So they are in need of additional financing for just managing where they are and the loss of revenue and cash flow. And then the other thing that came up was confusion around their eligibility around some of the federal programs. And again, if people would go to Erie County's website under their business page, there are a ton of resources there.
Great, thank you. So we are towards the end of our time, but I do want to give just a final 30 seconds to each panelist for a call to action. If you could tell the audience one thing in 30 seconds that you want them to take away from today, what would it be? And I'll start with Marie. We'll go in the same order.
Sure. First thing I would say is that we remain vigilant about the disparities around health and social determinants of health, and really as a community come together to tear down some of the structural systems that marginalize communities, especially poor communities. Then the other thing is to support local businesses, because they do need the revenue to get back and to hire and to employ. And then the third one is also to support local not-for-profits, because they're actually going through the exact same thing. And these are the organizations that are providing the basic needs to our community. So support locals, support businesses, support not-for-profits, and then we really do some collaborative work around the disparities that have become glaringly clear.
Great, thank you. Dr. Iyer.
I think I would like to echo something the pastor pointed out right at the beginning of this. It's just that never before has there been a need for us to come together collectively as a society to help each other out. I think a crisis like this brings out the best and sometimes the worst, and I think we've seen a lot of good things come out of this. We just need to maintain that momentum and make sure that people take care of each other. We support the healthcare system, and the healthcare system supports the community in fostering better health, better cardiovascular health, better mental health, better health in general. And I think this to me has been the greatest lesson here, is that even in a crisis like this, we have been able to hold it together. We've been able to provide the care. We've been able to take care of people in probably the worst of circumstances. So I have great confidence going forward that we as a society will do what is right and take care of each other.
Thank you. And Pastor Pointer.
Well, I think I would just simply remind us that we need to breathe deeply and exhale, that this too, in the words of my grandmother, will pass.
Great. Thank you. Thank you, Dr. Iyer, Marie, and Pastor Pointer. This has been fantastic discussion. I wish we could go all day, but we're at the end of our hour. And thank you for all that you do in the community. There's so much more that people don't realize, that the three of you are really behind. Your talent, time, resources has been amazing thus far, and we are so lucky to have the three of you in Western New York. And thank you to everybody that has attended today. This call has been recorded, so we will provide it back, and we will circulate it in other areas around the community. So once again, from the American Heart Association, thank you, and have a fantastic rest of your day.
Thank you, Mark. Before I log off, I think it's important for me to point out that the Heart Association does a great job for the community. And I think it's important for us to support the AHA as well. Thank you.
Amen. I'd echo that. Thank you to the American Heart Association, and thank you for the work that you are doing daily. God bless you.
And I will echo and ditto that as well. Thank you.
Thank you very much for that little plug. I appreciate it. Take care, everybody. Stay safe, stay healthy.
Thank you.
Take care, you too.
Thank you.